Okay, ladies and gentlemen, we'd like to call to order the Rutherford County Benefits and Insurance Committee. And first, we need to approve the minutes of the last meeting, and I'm sure since they were so very brief that you've all read that carefully. Do we have a motion concerning those minutes? All right, Ms. Hickerson is second. Ms. Boney, did anyone have any corrections or additions? All of you in favor of that, then please say aye. Aye. Any opposed? Okay. Mrs. Stinson, you can now tell us about the financial condition of our health insurance funds.
If you'll refer to Fund 264, we will begin there. For the month of April, our per employee per month cost was $910.27 compared to prior year, same time of $853.56. Our current year-to-date average, when we look at our medical, dental, and vision experience through Cigna, is averaging $820.97 per employee per month compared to prior year of $808.70. When we combine our on-site medical clinic costs, our per employee per month insurance plan cost rises to $949.11 compared to prior year of $903.81. With a year-to-date average of $856.51 compared to prior year of $841.77. So we are trending just slightly higher than prior year. Fund 266. Our year-to-date average is $648,450.41. compared to prior year of $903,207.21.
Okay, does anyone have any questions? Looks like we're just slightly above last year, and even on the second piece, we're a little under.
That's right. We're trending very well.
We could have one or two trends like that, we wouldn't have to have 3 4-hour meetings next year.
So we hope.
Okay, if there's nothing else, we'll go on to the workers' comp and the OJI report. Mr. Goode. Mr. Goode.
Good afternoon. Should have a copy of the report there in front of you, and you'll notice that in the month of April we had a total of 15 injuries requiring medical attention. You'll see their breakout there. That brings the first 4 months of this year to a total of 67 injuries, of which 51 of those were OSHA recordable. 34 of them had restricted days, 11 lost time days, and 6 others. On the next page, you'll see the graph, and it'll kind of show you where the first 4 months of this year has been to the last 2 years previously and where we were for those years also. The total dollars incurred for the month of April were $34,865. Of the 15 injuries, 10 of them were with the Board of Education, and the total dollars incurred for those were $22,315. And the county general had the other 5. Total incurred dollars for those were $12,550. And then, of course, the last page of your report will show you where those 5 were within the county area. Are there any questions at this time?
Mr. Good, could you tell us how many open worker comp claims we have?
We have a total right now of 24 open comp claims. And those are mostly medical that are just keep going on.
Not reasonable to think that they're going to drop off. Many of those will continue on for lifetime benefits.
Yes, and then sometimes when we think we've got them closed, they'll actually come back and even reopen. And 1 month you'll be down, and next month you'll be right back up because, again, they are kept lifetime open. So.
We were trending somewhere around 1920 for a very long period of time.
We've had a couple come back in the last couple of months that have opened back up.
Anyway, it looks like our OJI trend is good.
Doing good. I hesitate to say anything about this month because this month it looked good, but as soon as I say something, it'll shoot up. So I'll save this month's numbers till next month.
Of healthcare, right?
Yes, sir.
All right, well, thank you then, if there's
Thank
no
you.
other questions. All right, Ms. Kelly PERRIEN, you're going to tell us about wellness, and how much we are improving.
Hi, everybody. Our April program was Stretch It Out 30-Day Challenge. This included a calendar log, a work smart stretching plan, and weekly information on the importance of stretching, taking micro breaks at work, and stress relief and eye strain, and then included a post-eval survey. We had 52 people participate in that. 55% of the survey participants indicated before the program they were not using the proper stretching techniques. And when asked how many stretched every day before the program, only 37% said yes. After the program, 86% of the participants said that they plan to continue daily stretching with the proper techniques. So through this program, the amount of participation stretching every day was increased to 127%. And this helps with our stress management, concentration, and can lessen work injuries. Our mobile mammography unit came May 6th and 7th, and we had 34 people attended, and that's a 70% capacity rate for the mobile bus. Our one-on-one coaching has 13 active cases for April, with a 65% rate for follow-up coaching. Our upcoming activities, we have a Setting Retirement Goals webinar through Life Services on June 18th, as well as a food preservation class at Lane Agger Park. The next page in your packet shows a summary of the April 2012 to March 2013, broken out by quarters. As you can see, we've been really busy. It lists all the events that we've had the last year. And I'm happy to say that our total participation count for the past year is 1736. So does anybody have any questions about anything? Mr. Gina?
On the wellness coaching, how is that different from the Cigna program of their coaching that they have, or is it tied as the same thing?
They are two different programs. The Smart Steps program tries to offer different formats because people learn differently and their schedules are different. The Cigna programs are telephonic or online, and the one-on-one coaching is face-to-face coach with Lori Cook, the wellness specialist at MidPoint Clinics.
I have one more question. On the survey that was recently sent out,
Yes, ma'am. We haven't actually closed that survey yet. I was hoping that I could get some more feedback right now. We've had about 220 employees answer, but every day I'm checking and we're having a few more people answer, so I'm just kind of waiting a little bit longer to see if we can get more feedback. Anybody else?
Any other questions for Ms. PERRIEN?
Thank you.
All right, thank you. Okay, the next thing we have is payroll deductions. County General, and Ms. Stinson, are you handling that?
Yes, sir, I am. This is just more of an update for the committee. I was requested, seems like a couple years ago, I think it was actually a few months, to take a look at our payroll deductions. And there was actually a survey sent out for County General employees by Ms. Stevenson, where the question was posed, would you like for your insurance deductions to occur twice a month, half being taken out of one check and half being taken out of another, versus the way it is currently done, deductions come out of one of the two checks. And the response that was received back was that for County General employees, they would like to have that happen. And so effective 1/1/2014, we will actually be taking payroll deductions out of County General employees only, splitting those deductions and coming out twice during the month. And that will help them to have more even deductions versus what's occurring currently. So I wanted to provide that feedback to the committee because that recommendation did come from the committee.
Okay, then, thank you very much. Wellness biometric screenings, and I believe Mr. Jay Brown is going to present this information.
as Mr. Brown's coming forward, this is, we had talked about what can we do. As we went through the budget process related to rates for 2014, we showed that our utilization from an employee perspective in terms of the selections they were making was actually running pretty good. What is our next step in controlling behaviors and encouraging employees to make best healthcare choices, which ultimately will lower our cost? One of the things we talked about was looking at a wellness initiative around biometrics. And Mr. Brown will talk about a proposal that we have for the committee's consideration of something that we'd like to look at beginning in 2014 that would be directly tied to the premium rates as well. So, Mr. Brown, if you'd like to go.
Yeah, we started this discussion, I think, last time. We had a lot on our plate in the last one. So over the last month, I've been able to put some additional data together. And what I handed out to you there is kind of a wellness analysis. One of the questions you had of me from that last meeting is to provide some additional data on the costs and potential savings of the program. So essentially what happened is last year we increased the disease management programs with Cigna when we did the RFP on the carriers. And part of that program was I think one of the flyers you have in front of you, the Your Health First flyer. And then you also have the utilization, which is kind of the purple outline chart there. And we've really had over this past year, when you look at the period there, low utilization into the disease management program. And essentially what that does is maybe kind of lead into the questions there. If you have your on-site clinics who has some wellness initiatives, Ms. Kelly and her team does several wellness initiatives throughout the year. And then you have this program through Cigna called the Your Health First. And essentially what that program does today is it can look at your claim utilization to drive them into the health coaches and manage chronic illnesses. And so what we're really trying to do in a big push in wellness and with all the insurance companies is really to get employees to know their numbers. And so what we're trying to encourage this year is to encourage each employee to go get an annual exam or at least get their biometric information so that, as you can see on the handout that I provided, so that you would know your BMI, know your cholesterol levels, know your blood pressure, and things like that, because obviously the first part of that is knowing what your numbers are before you know if you have an issue or how you can control those symptoms. And then as part of this program, by going to your own physician or going through MedPoint or the Take Care clinics, that information will feed into the Cigna model. And if there is a chronic condition or something that raises a red flag, then they would have an outreach call from Cigna to talk to them about some of the categories listed on that handout on number 5, or a list of some of the categories. And so it really just gives that member someone else to work with. Maybe they didn't know about the condition, so this may be the first time they're aware that they have high cholesterol. So they may talk to somebody at Cigna about increasing their prescriptions or getting a prescription for that. Cigna may encourage them to go talk to their doctor about this. I mean, so they want to encourage that relationship with the primary care physician. So there's a list of things there, but essentially what we're trying to do is bring awareness and increase the participation in this program that you already have in place. And so what we have found the best way to increase the participation is to have a financial incentive tied to it. So one of the things that we're suggesting this year is increasing the employee contributions by $25. And then if they go to participate in the biometric screenings and do the things listed here, their contributions would be reduced by that $25 fee. For the employees that did not go to the biometric screening and do that, their cost would continue to be increased by that $25 throughout the year. And so most of the surveys say that it's around a $250 to $300 impact on an annual basis is really kind of that threshold number there to get somebody to actually do something in the wellness realm. So this would be, $25 over a year is $300. If they, at this point, all we're asking them to do is go get their annual examination. We're not saying that they have to be at a certain level or their certain cholesterol level just to have a participation-based program, but that will drive some utilization into these Cigna programs that you're already paying for as the county today. Now, on that slide, as far as the cost, we did a kind of analysis at the very bottom, really getting into the details. One of the thoughts here is, on average, you have about 5,200 employees on the medical plan today, if 80% of those employees participate, they go get their annual exam, then we say an average exam visit's going to be around $110 for that visit. So this is at the bottom, number 10 at the bottom. So the biometric screenings, if 80% of the population go at $110 per visit, that's going to cost $457,000. Of that, 20% of the people are not going to go get their biometric screenings is what we're estimating. Of those 20%, 1,040 people, they're going to pay $300 a year more for their insurance, which equates to around $312,000. So what we're trying to do is get to a metric there where we're going to have additional cost in the health claims by all these people getting their annual exam, but we're also going to have a population that doesn't do it, and then it's going to pay $300, and that's going to be an offset. The county would still be responsible if that percentage happened of about $145,000 in difference. Now, that's really just trying to show how this program would work. Now, what we are seeing working with Cigna and their actuaries is that we were projecting this year with the percentage of the people that were in the program, in the renewal this year, we had projected savings of about $373,000 in claim savings of the population that participated in the program. We think by bringing some more awareness around this program and tying in the financial incentive to get your annual exam, that conservatively we should be able to double those claim savings listed down before of $373,000, which would bring a total projected savings in the disease management program of $747,000. So you'd more than make up that difference in the potential cost of offering the program and still see some additional savings, because really from our last meeting, we set the budget. We were trying to make some wrongs from previous years, but we don't want to lose sight of what can we do to continue to lower claim trends so that next year's renewal, we still see that low claim utilization. So this is kind of one of those first steps in leading into that direction by offering this type program. Any questions about that so far? I know I said a lot. No, I said a lot. So,
Ms. Barnes?
Make sure I understand this correctly. We're proposing in this option that we increase the employee's contribution by $25 a month, and then if they participate, we take it back off.
Right.
But if they don't participate, we're going to increase everybody that doesn't participate by another $25?
by that same $25.
Folks have taken a big enough hit this year then to add something to them. If we can deduct $25 for participating from the figure that we have in place, that would be a wonderful thing. But to add to it, I would have to vote no to that.
Harvey and then Ms. Nolan, Ms. Ely.
Okay, so I agree with Ms. Barnes about the extra cost. I agree with her completely about we've already raised the rates once, and I think with us adding that burden of $25 is just going to be totally too much for the employee. But if they go and have the blood work done, and that's $25 off for January.
For the whole year.
Or
Each
for the
month,
whole
for the whole
year.
year.
Okay, so they have to have the blood work done, and that automatically will take off the $300 we're overcharging them in the first place. Okay.
Can I interject real quickly, though? We wouldn't be overcharging. We would give everyone the benefit of the doubt that they will go in the period specified and do the biometric screening. And then when the period closed, we would do the adjustment only to those who didn't go get the biometric screening done.
This is a voluntary. Some clients say it's mandatory to do this to have insurance. We're making it a voluntary program. You're not required to do this, but if you do not do it, you pay more money.
Okay, so then there would be someone in payroll or someone at the insurance department that would go in and physically click who went and who didn't during that.
That's correct.
We would have a wellness
span.
credit, most
Okay.
likely.
So if we don't do it at the MedPoint Clinic, if we have this series of blood work ordered by our doctor, then is that considered a wellness blood work, and they would pay, Cigna would pay 100% for that? So you wouldn't necessarily have to go through
Out-of-pocket cost for the member.
the clinic.
The key to that is listed here, and we'll have to have some more communication around, is we do want to make sure if you go to your own provider that they funnel the the lab work through Quest or LabCorp, who are contracted with Cigna, to make sure that Cigna gets that biometric information. But that would be in our marketing and communication at open enrollment.
Ms. Nolan?
This would only be for the employee and not the spouses at this point. Of course, now I'm not a voting member. And just on the first two comments, would there be thought to, as you're doing your materials, to say this is a way you can reduce your 2015 premiums, and you've got a whole year to know your numbers? And could we use if you got your numbers in 2014, we could go into 2015 already knowing that maybe.
Yeah, I mean, essentially, this is the beginning of more going. I mean, I had 2 meetings yesterday with large clients that are honestly in stage 3 or 4 of this method, where this year they're saying you have to have a certain BMI, cholesterol level, blood pressure level, and there's points associated with that. That's more of a results-based model, so they're 3 or 4 years down the road. I mean, City of Knoxville is a client of ours. That's where they are in this type of program. But obviously, you have to take baby steps to get to that point. Baby steps with your wellness you've had today, making it participation-based. All we're asking them to do is go get an annual exam, something we all need to do anyway. So to encourage you to do that, we're saying we're going to save you $300 if you do it. And then maybe next year it's where the spouse might have to do it. The reality is, if we're going to make behavior changes, usually it's a team effort. The employee and the spouse have to do something like that. So it'll be a multi-year wellness strategy that we haven't designed completely yet, but this is kind of baby step number 1 into that process.
Come back to the others.
How does this fit with our existing HRA program that we have in existence now? Is this like an enhancement of that? Would the employee get credit for an HRA? Or is this more comprehensive than the HRA?
HRA is a health risk assessment, so it's like just a medical questionnaire. Essentially, the questionnaire is you're filling out a questionnaire, and we're taking your word on it. A biometric screening is more of it's your blood draw, and that's the information. So go ahead.
No.
It is more comprehensive because it would be a complete blood panel that would be ran. Right now, our HRA information does not pass into Cigna. And so it's not triggering these disease management programs that we have at Cigna. All of the statistics included in this is actually based on claims data, lab values that have passed through Cigna. And so that's where the gap is right now. And that's what this proposal would close, would be to get them actually into the Cigna system so that they can become aware and their medical care can be better managed from a disease management perspective.
But didn't we have some sort of I don't know whether it was limited or not, but I know some of the ladies in my office, they went and had some pretty extensive blood draws and what have been reviews. What program was that under?
That is the HRA that Commissioner Ely has talked about. That is through our MedPoint clinics. But those results do not feed into Cigna. Our goal is, first off, to drive the participation of those that are actually getting the physicals and the biometrics, as well as getting people to understand what their numbers are and what their risk factors are, so that we can better manage the claims and experience inside of our plan to potentially save money in 2015. I know that we're all still very fresh off of the 2014 premium discussions, but we have to start looking forward, because believe it or not, the time period in which we're going to start having discussion about premium again is going to go pretty quick. And so every month we're going to have to start talking about different ideas to start affecting 2015. Which is why we're bringing this to you today. This is a very common practice in terms of steps employers take to better manage their premiums and their health program that they have.
Mr. Jordan.
Well, I like the concept. I mean, I could probably even support making it mandatory, but I've already got some feedback from some employees that are wondering, you mentioned first step, where this is going. 3 years down the road, if we got a different rate for somebody that's overweight or somebody that's a tobacco user or somebody that does what? And and I just worry about where we're going. I mean, do we start having a different rate for somebody that drives a motorcycle? Because that may be more dangerous than driving a compact car or something like that. I mean, I just wonder where we're going with this, because then you say first step. I'm okay with this. I wish we had framed it a little differently and include the $25 in what we approved last month, and then we could get a credit that way they could get a deduction. But instead, they're going to see it as an increase on top of an increase. But I'm worried about where we're going, and it's probably a necessity industry-wide, but it just scares me when we start dealing with what we do with the numbers after we get them.
And honestly, we have not had the conversation. We don't have a framework of a multi-year strategy at this point, but as a consultant who works with over 200 clients, most of our clients that have those multi-year strategies are saying more of, your health insurance needs to be like your life insurance. You buy life insurance, there is a tobacco and a non-tobacco rate. Your car insurance, if you get a DUI or speeding ticket, your car insurance goes up. If you don't have smoke detectors in your home, your homeowners, every other insurance has implications on your behaviors. So employers are now saying, why is health insurance any different? I mean, if I choose to act differently, maybe my rate should be higher. Now, that's where the industry is going right now as far as wellness. You guys aren't there. So, I mean, I know not to come out and say, let's go year 4 and year 1. But over time, large employers are doing that type of program now. I'm not asking that as, you to vote on today, but I can say over time, that's where you're most likely going to be in 5 years if you're going to sustain this program the way it is at affordable costs. We can continue to change plan designs, pass on more cost to employees to keep the budget number where it needs to be, or we can try to manage the claims so that we don't have the increase. And this is a big part. I mean, we look at it typically, there's 3 legs on a stool. Wellness is one leg, disease management's the other, and consumerism's the third. You have the HRA. We talk about the HRA program. Disease management and wellness are tied to these 2 legs of a stool to control your cost. And that's where we're kind of focusing on these 2 this year.
Ms. Harvey?
I think that I could accept this a little bit better if it was maybe presented, since we're going to be saving. If we had this done, the estimated savings is $373,000. Is that correct? Am I reading that right? Instead of tacking on a $25 surcharge per premium every month, if you go and have your blood drawn and have this, give the employee a $50 gift card, or give them something instead of them, you're charging them and then taking it away. Hand them something that they can get a positive feedback of, I'm going to, and I'm going to get $50 if I get my blood drawn.
Yeah, this we've
I think
seen-
you would have a lot of participation that way if you did something that way, rather than to try to backtrack and keep up with who's done it and who hasn't.
Right. I mean, I think typically, you still have to track it to know how to give them the $50, but typically we would say, here are your new rates. If you do this, it goes down $25. So, and what we've seen is a $50 gift card is not going to make somebody go get an annual exam. It's got to be $250 or more to get that person to go do it. And so we've done those programs 3 or 4 years ago, and the gift, it would have to be in that range of a gift card really to get somebody to move in that direction.
Mr. Gammon?
Yes, sir. I'm kind of along the line of Commissioner Jordan, and I don't want to muddy the water or anything, but my question is, can this be mandatory? Can you make an employee have this screening?
It's a little, actually with healthcare reform, which we haven't talked a ton about healthcare reform, the details of the program, there is a wellness component as part of the PPACA regulation. And it is very employee-friendly and has a lot of other regulation requirements as part of that. And honestly, it is frowned upon to make a wellness exam mandatory.
I understand. I understand where Commissioner George is going to where's this going to end up, but again, we still have to look at the fact that it is a cost, it is insurance, it is provided, it is part of our benefits, we earn and all that. But at the same time, it seems like to me that if we're concerned about employees and assessing their health to make a savings, plus maybe save their life in the long run, give them 10 more years in their life, that we kind of look at that a little more serious about mandatory. And then if someone doesn't participate in the mandatory, I'm not saying you discipline them in a sense of firing or anything like that, but let them pay $25 more a month, the employee, if he doesn't have the assessment. It's a choice.
Well, when you say mandatory, what we typically do in that instance is if you don't do this, you do not have health insurance. That's what mandatory means. That's a pretty, $25 a month is
I
one
wouldn't agree with that.
That's what, I mean, when you say mandatory, that's what we're meaning is if you don't do it, you don't have health insurance. And I don't think you want to go down that.
I'm just saying that I'm kind of like everybody else. I know there's parts that's got to be paid. The taxpayer pays it. We're taxpayers too. We need to contribute and all this, but there's already going to be an increase, and it's a hard battle for the commissioners and the mayor to deal with. But at the same time, we do this on top of that right now, and I'm not saying it doesn't need to be done. I believe, personally, I think it ought to be mandatory. I mean, I definitely participate because you need to find out if you have these issues. I know of people who have went for the health risk assessment and found out they had cancer and lived. Well, if they hadn't went over the next 5 years, they probably wouldn't have. So that's just my 2 cents worth.
Tough year. I mean, I get the point of this is a tough year. We've had a big employee contribution increase, and then you put this on top of that. I don't disagree. It would be great if it was a rate pass year, no increase, and we're saying we're going to raise costs $25, and if you do this, you get a rate pass. But that's just not where we are this year. But we are still trying to look forward and say we don't want to be in this spot next year either. And so it's a tough position.
Mr. Hall.
Two questions, kind of real quick, but on that, the savings right there, which would net you out the first year, you're talking about $227,000, I think, after you take the cost of the exam out of. Anyway, it was $373. Is that just in medical services that would not be purchased, or did y'all include employee time down from sickness or something like that into that number to get to it?
Question. This is really just claim costs, so it's an actuarial number. So it's even saying this person's heading down the road of having a heart attack. They went to get their annual exam, and by taking some cholesterol medication or some heart medication, you got those numbers under control, and you save that train wreck from happening. So it's actually looking at the factors of what happened when they go to the examination, what risk factors were determined, and some formula of controlling those claim costs. So it's totally agree. Wellness, the conversation I had last night at a board of physicians that were thinking about doing the same program, they were really focusing in on if you have a wellness program, your organization is typically more profitable because you have employees that are typically more active at work. There's less, they call it, there's absenteeism, and then there's, the employees that come to work and that just aren't there. So it really does encourage other things outside of claim cost as far as an organization, but that's not included in this number. That would be an additional savings.
And then my second question was we're talking about $373,000 this year, which out of $50 million purchased of healthcare services and pills and drugs and stuff for a year, it's not a very big number. Where are we going? Where does the number start changing big as a percentage? Because $300,000 out of a $50 million plan,
right,
is not. It's not going to be. I mean, where are you talking about the steps that can you take it through a little bit of the steps, what you're talking about, and how big is that number going to get? Are we going to see in year 4 of something?
Right, and this is, like I said, just my opinion of what other clients are doing that I work with. We have not had this conversation about where Rutherford County goes, but yeah, you move in this direction, and I mean, we could go back and say, what were your claim savings in your wellness program as it is today last year? We could kind of look at that. The next step is this know your numbers. Just because you know numbers still is not necessarily going to change that trend line number. We're expecting it to change, by this amount, which is a percentage, not a lot of money. It's 1%. But as you start driving behavior, if you start saying, well, if, average BMI is 29.9 and you have to be at that range over the next year, or you're going to pay $25 more for that. And if you're non-tobacco, you pay $25 for this, or you start looking at the different factors. Honestly, that's when people change their behaviors, and that's when you see more claim savings. So it's over time when you evolve the wellness program over, it may be 10 years before you're there. I don't know. But it's when you get to that level is when you really start seeing the claim savings. But you have to start somewhere. So you have to take a baby step. Usually in this year right here, you're just trying to justify the cost. So I know I'm going to spend $400,000 more in potential office visit claims. I've also got some administrative headache and, things like that. So how can I make up the cost so at least I'm neutral? And so here it's not only neutral, it's still going to save the county some money this year, but it's setting, those baby steps to where you may go and who knows when. And that's when you get over here is where you're going to see the bigger savings, but nobody just jumps right into that. So.
Ms. Hickerson?
Well, in looking at this, I think the $25 is a good idea because I realize we just raised the rates, but you don't have to pay the $25 if you go do this. And you don't even have to pay an office visit if you go to the MedPoint clinic. So ultimately, you could do this, save yourself that $25 will tack on, and save yourself a doctor's visit, and there has been no increase. If you choose not to, then you should pay the price. And ultimately, if we don't do some kind of savings, we're going to make it to where there could possibly be, ultimately no plan, but we could go back to a plan that is not near as thick and fresh as ours is. And I don't know if if the state is, but it was mentioned that the state or the teachers or something, there are price differences for tobacco use and things like that already. We don't have that yet. We could, but we could do this $25, tack it on after our time period, and it's your choice whether you've done it or not. And it's your choice whether it even costs you an office visit, because we have the free clinics for them to attend. So why not try to help the plan on reducing potential claims and savings that could help offset major premium increases like we've had? If we don't keep up with this, we're going to have a year like this on the premium increases every 2 or 3 years if we don't each year do something. I know y'all hear that from me all the time, but we just went through it, and it just proves that we need to continue to do something to keep the plan as nice as we have it, because you ask a lot of folks, we have a nice plan. We pay for it, and we appreciate it, but we also need to step up and do our part on keeping it as fresh as we have it now.
So then we'll come back.
Since I've never talked at these things before, I'm going to open my mouth for once. I'm sitting here looking at the cost of biometric screening, $457,600. And if everybody goes out and gets this done, it's still going to cost the county $457,000, right? Okay. And so the cost of the county would be $500,000 instead of $145,000. I'm all for everybody going out and getting healthy. I guess my thing is, if all of a sudden we have 10,000 people run off to get this done, are we capable of getting that done?
Well,
the clinics.
We initially looked at making it where you would have to go to the MedPoint or the Take Care clinics. Mm-hmm. And honestly, the time frame this would be is probably going to be in the October through January time frame, because we want to try to get it done before the January contributions would change potentially. And that's high month volume at the clinics, because that's the winter time. And so what we worked with Cigna is to say, you can go to any doctor as long as they're funneling that through the
as long as you turn in your numbers to them.
So that way it spreads out that volume where we don't have 5,000 people trying to get into the clinics, and then also the flu and the flu shots and all the other stuff. So actually,
I had mine done. It didn't take that long. It's not that
it's
hard,
not.
And you run in, they take your numbers real quick. You're probably there 30 minutes. How long did mine take? You remember? No, I'm putting you on the spot, aren't I? Yeah. Okay. Yeah. It's not that long to do. It's not even painful. It's in and out pretty quick, and I don't mind getting all that information turned in. My question is, though, if everybody runs out and does this, say we hit up all the employees and we say, okay, look, if you don't do this, we're going to charge you $25. So the 80% run out and do it, and the 20% that don't, they've got to pay the extra $300 a year. That seems fair to me. Instead of saying, we're going to hit up everybody, it's kind of along the same thing. I think we're talking the same language here. But my whole thing is, as long as we've got it where everybody can get in and get it done, and everybody's aware, we do a lot of advertising on the front end. I could be for it, but I just want to make sure that we understand that we're not ponying up for $150,000. We're probably going to pony up for more like $250,000, $300,000. That's what's going to cost the county, because we're not going to, if everybody's going to run out and do it to save the money, they're all going to run out and do it to save the money, and the county's going to have to pay this $457,000 or something near that. So,
right,
which I'm okay as well, as long as, like for me, I got my numbers. I think I've been to the doctor and into the clinic thing once in 5 years. I'm a pretty healthy guy. I never go to the doctor for any reason. So my health care claims aren't going to go anywhere whether I know my numbers or not. So those are some of the numbers that, you're going to have that as a trend as well. But I do think that at least we can start getting our population start being a little more healthy. I'm for that as well. So as long as this is PR'd and marketed properly, I'm okay to implement it. But I'd rather see it done as a plan of, everybody's got a deadline to get it done. There's a lot of advertising, and if you don't get it done, then we're going to hit you with an extra $25 a month or $20 or whatever it needs to be, or something to make it as an incentive. That I'm okay with. But as long as it's set up to where we everybody has the ability to get it done, I think the initial run on the clinic, I think is what scares me most, is people are going to start complaining they couldn't get a time and all that kind of stuff as well. So thank you.
Ms. Barnes?
I'm not adverse to the concept of this. I'm really not. I understand the need and the benefits to the employee. I'm going back to the money again because I really am concerned about this year. I have 2 or 3 questions. Is the HRA, the way we have it now, is it able to feed into Cigna at this time without this added cost?
No, it's not.
Cannot. That's not an option at all?
No.
Second question is, do we need to clarify that this feed can come from personal physicians? I think we talked about that a second ago. If you don't do it at the clinic or any other, if you do it at a source outside of the system, do we need to verify that feed can happen before we pass something like this?
We have. We've talked with Cigna. Essentially what the goal will be is they'll go to their doctors, all that's going to flow through, and then we have a list of SIC codes that Cigna uses for these biometrics. We're going to run a report at the end of January, if that's the time frame we use, to see how many claims ran through during that period with that SIC code, and that's the person who's going to get the credit. So we were trying to find a way administratively where the teachers aren't, submitting a form to the principals, and the county is not having to do all this administrative paperwork to get this credit. So the best way we've come up with is using the Cigna data that'll get flowed through these SIC codes to report back to payroll so you can get the credit.
Every physician is going to know to send this kind of data through Cigna?
To the Cigna recommended labs, which are LabCorp and Quest. So, and that's going to be, we'll have to work with our marketing company that does the open enrollment anyway to spell out, and I didn't hand it out, but I started a little bit of a communication to employees, a little nicer than what I provided here of what the goal is. The goal this year is to know your numbers. We're encouraging this year to get your annual exam. You have 3 options. If you go talk to your doctor, make sure they know to send this here or here. Talks about why we're doing it. And it's pretty much the same thing I handed out, but in a little nicer format. But we'll work with our communication company to make sure it's a better piece before it actually gets in employees' hands.
Backing on what Joe said, I think it's really going to be important if we do this that we set up labs at every school, at every department on multiple occasions. I know we don't have the manpower to do that, but if you're going to do this right and offer people that opportunity to have this blood draw done, then you're going to have to make it accessible to them because not everybody can get into the clinics at that time. So just think about the concept of providing an opportunity for all of our staff who are members of our health care plan, and if you're going to set a time frame from October to January and say
4 months, yeah,
try to get it done, that's a real large feat of people, so that concerns me as well. And then the last comment I want to say is I wish we'd thought about this sooner and had time to talk about it before we'd gotten into this, and of course we haven't, and we consider a year to promote this to people and say, this is what everybody needs to do, and next year we're going to assess a cost and give them some time to plan and think about it, and maybe just drum it into them a little bit more without having to put those extra dollars into it this year.
Just a couple of things, if I may. This isn't the first time we've brought this to the committee, so I don't want to leave with the impression that it is. We actually referenced this at the work session. We actually had it on the agenda at the last insurance meeting, and it was voted not to be discussed after we went through the rates, but that you wanted to hear more about it, which is why it was placed on this particular agenda, the next meeting agenda. So I don't want to leave with the impression that we're just now introducing this, because that's not the case. In terms of the reason why we were looking at a 4-month period was to allow people to actually go get the testing done. It would be over Thanksgiving break, 2 weeks of Christmas break, time when majority of the employees on the insurance has a considerable amount of personal time off. The cost to go to 70-plus locations to do this blood draw, it's going to double this number. I mean, we'll have to hire nurses to go out and do that. So the whole purpose of doing something like this is to create ownership with the individual. And if we can't reasonably expect employees to find in a 4-month period 30 minutes to go take care of this for themselves, I don't see that we would ever have a 5-year strategy. I mean, we have to at some point turn the tide to say this is a partnership like what Mr. Brown referenced, and it's a give and take relationship in terms of trying to balance who's paying what inside of the health plan to keep it at a level that's both attractive for employees and for the county.
Let me ask a question, then I'll come back to Mr. Sandvig. Are we talking about having blood drawn? Is that all we're talking about here? Once a year, having blood drawn? Just this year for now, but I mean, that's all that's all this program is. And once you draw the blood, it's either sent to LabCorp or Quest. Okay, so how many of us in here have an annual physical examination? Everybody in here has held their hand up. Do they draw blood before you go visit that doctor? I mean, I don't quite get all this. Most people don't.
Not get an annual
Most
exam.
people don't. So
They're on
this
the
is a
insurance
unique.
committee, so this is important for these guys. They're on the committee.
No, I didn't. I give blood about 4 times a year for different reasons, but I think
People do not.
Yeah. I think that we looked at it, and I'm going to look for a nod from the audience back there. Around 40%, is that correct, Mr. Huffman, actually get this type of exam inside of our population annually.
I can't really see quite why, back to what Virgil said about mandatory, why this is just not part of open enrollment. When you haven't completed your open enrollment until you've had your blood draw. Send it all in together. Okay.
That may be our year 2 strategy.
I mean, in 4 months, we can all make a doctor's appointment or go to one of these clinics. 30 minutes or 1 hour of our time. And if you be there at 7:30, you won't have to wait more than 30 or 45 minutes. Mr. Sandvik hadn't said anything, Mr. Gammon.
Could we broaden the time frame, start it earlier than October 1?
We just have to
if
communicate
we
it sooner.
get the word out, but again.
Yeah. The goal was open enrollment started October 1st, so that's when we would tell them. But if you were in agreement to give some notice prior to open enrollment.
I'm thinking of summer for Board of Ed employees.
Have to know the contributions for sure.
Oh, I realize communications would be a challenge, but.
I'm curious how we could do it. The answer is yes, we could do it. We could start it tomorrow if we slam something together and get it out there. It may not be the best, most thought-out approach, but we could get it done relatively quick. The thing is this, though. It's June. The rate impact isn't going to happen until January. I know from open enrollment experience, if we give them a month, they're scrambling against the clock at noon on the last day. I just don't really know how motivating it would be, but if that's the consensus of the group, we need to give them 8 months to make a doctor's appointment or whatever the right time frame is, then we're willing to accommodate that. I just don't know that we're really going to gain much because they don't have all the documents in front of them to truly do an evaluation of, oh, wait a minute. The motivational piece is, hold up, I'm getting this as a increase next year, and I'm going to have to pay $25 more if I don't give back something, which is go take care of one piece that they're asking me to do, which is the biometrics.
Typically, we see where you want to give them more of that leeway is if it is results-based. You know, you wouldn't want to roll this program out in October and say you have to have these certain criteria met or else your rate goes up. You want to give a year or two leeway for you're doing that, but as we said, we're just asking them to go get an annual exam.
Mr. Gammon had something else. He was next, I think.
Your question.
I only heard
Could
about
we
half.
extend the period? If we say it's January and somebody does it in March and comes and wants a reduction, are you going to allow them to do that?
I would say no. I mean, initial reaction is no because
You're adjusting payroll all year for people.
That's right.
Then. It's administrative. Or I mean, it's right. I mean, there's no rule saying you can. It's more of an administrative burden, and employees have an accountability of that. But it's, you know, it kind of dilutes the program if you start doing those type things because next year, well, I was 0.2 of a point over on this or whatever, so can I not get that credit? So, but it's nothing saying you can't do it.
Mr. Hester hasn't said anything yet. He wants to speak.
Okay, is this better? Okay, first of all, I think we need to put some responsibility on the employee. I agree 4 months is plenty of time. Okay, I guess my question is, when is this to be effective if it's adopted?
Well, it would be in conjunction with the 2014 premiums.
So the extra $25 would be charged starting in January 14.
What we would do is, as Mr. Brown said, we would probably extend it through the month of January. So then we would go in with the assumption that everyone's going to do it. So in January, we would charge the premium with the credit applied. And then once we receive the data from Cigna, adjust to those who didn't get the test done within the 4-month period to include that $25.
Okay, with that understanding, I'd like to make a motion we adopt as presented.
And a second from Ms. Hickerson. Further discussion?
I've got a bit of a problem with what Virgil, well, I agree with Virgil. I mean, if somebody doesn't get it done till February 2nd, I wish there were a way that they wouldn't be, well, they're not going to get it done February 2nd. There's no point in them getting it done February 2nd. And well, people have a physical every year at their regular position, and that covers it. That happens to be in June or July. I mean, I think we need these people in a yearly thing, but I wish there was a way to let them do it anytime during the year, as long as it's done by January 1st. So next year, if they get it done in April or May, that covers it. If that's when their physical falls, because most people's prescriptions run out at 12-month intervals and stuff, and if your regular physical from your primary provider happens to be a May or June date, that's useless to you. You know, so I just wish there was a way to make that work. And at least during the first year of this, whenever they get it done, that cut that off. I know it's a payroll nightmare. And when you get to the next levels of it and you start talking about BMI and different things and, you know, well, I'm going to lose weight next month and fall, but that gets pretty gray area real fast. But, I mean, I'm going to support this motion, but I wish there was a way to let that be more than that 4 months.
We can talk through that more. I mean, because we even talked about what if somebody just had it done in September. So now you're saying I've got to do it in October, November, December. I just had it. I mean, the thing is, Cigna does allow, part of the plan, it would allow for you to have 2 annual exams covered by the plan. So it's not that they would have to pay a copay, but it starts increasing your claim cost. If I did it in September, now I have to do it in October. But at some point, you have to have parameters and try to stick with it. And what that may be is still in question.
Okay, we're going to go with Mr. Sandvig next.
I have 2 physicals a year because of a minor issue that I have. Neither one of them would count, so I will have to have a 3rd physical.
Why wouldn't they count?
Because it'll be outside the time frame. The only other option we would have would be to say if you have one in 2013, then you, but the risk of that is we may not pick it up through the depending on if they go in.
Monitoring.
Right.
The way we were trying to do it is to eliminate the administrative hassle for the schools and the county by getting a report from Cigna, but we can't continually get a report from Cigna every payroll. We'd have to come up with a form to fill out and turn in, or some other way of tracking it. We'd have to do something like that probably.
Ms. Nolan?
Mine was just detail in just trying to think about how we bring those deductions over out of our thing, and thinking about Ronnie setting up and how it
rates.
Going.
What we were looking at really doing is, here are the rates that were adopted in the last meeting, and this would be a $25 wellness credit. So it's a one-line item on payroll that you would...
Like another deduction that will hit?
Just one.
Another deduction, separate deduction code that would come over?
Not a whole nother set of rates, but just a one-line wellness credit. Because I have other clients that have, here are the wellness rates and here are the non-wellness rates, and instead of...
Okay, so you increase all the rates $25. Okay.
$25
and then
credit.
The credit comes over.
That's a lot easier to manage from a payroll purpose.
Okay, so you'd give the credit until such time you found that they hadn't complied, and then they would not get the credit anymore. Let's see, who's sort of next? We got several. We'll go with Ms. Harvey, and we'll come back over here to Mr. Russell.
Okay, I kind of fit into Jeff's category where I've just had this done, but mine was at Vanderbilt, which doesn't feed into LabCorp or whatever. So is there a way that you can fax
It does.
your
It should still
information?
feed into them.
Oh, it does? Okay.
Mm-hmm. If you're, I think, in Cigna's here, if you show your Cigna ID card, they're supposed to send it to a Cigna contracted lab.
But if you went to some place that didn't, say your regular physician did not feed into LabCorp, is there a way to fax in those results or bring it in on paper, those results showing that you've done it and you have your numbers? If that's really what we're working for, is to everyone know their numbers?
I don't think we really want to have PHI going back and forth through and you sending in your results into the risk management department. And that's the concern with that piece of it, is then you've got your personal data getting sent around. So, I mean, I think we have within the county, you have very low to no out-of-network utilization. So, I mean, I think that would be part of the communication, is they really need to go to an in-network Cigna provider to make sure that happens. But, we can talk about a one-off, but I would be very hesitant to have somebody have their doctor fill out all that information and turn it into risk management.
And I have one more question. Will this affect the budget as far as school board of what they need for their insurance items? Okay.
We're going to assume everybody's going to participate, 100%. Let's see. Mr. Russell, did you have something else?
I guess my thing is if we're going to do this long term, and this is our plan, then when we have a meeting, say 2 years from now, and people are turning in their numbers and everything, and we're saying, okay, now the smokers get to pay more, and now the so-and-so gets to pay more. Who gets to make up those parameters? Do we as the body, since it's our plan, do we get to make up those parameters? Where we'll start docking people for extra money if they're not carrying on certain lifestyles and things of that nature? Okay.
Anything like that would come before a vote from you all.
Okay, all right. And then the other point I had was that since we set the rates for insurance once a year, and your HRA numbers are good for once a year, I don't understand why we just can't say you get it done in 2013, you're good for 2014. You get it done in 2014, you're good for 2015, and go that route. It makes it a whole lot easier. It takes all the time constraints off of everybody. Now, it may be for the office staff, that may be hard to do, and that's maybe the point that I'm missing. That's, but if it's not, if it's something it can be just a box you check off on the computer and get it done, that it's been done, so be it. So, because I'm assuming the HRA numbers are good for 12 months at least, right?
In essence, isn't that what we're saying? If we say as long as you get it done in 2013, you're good for 2014?
Yes, ma'am.
Am I understanding you correct?
Yes.
The only issue is I would prefer it not be an employee telling me they did it. I'd like to.
Well, yeah, you'd have somebody sending it in to you. Yeah.
Because we can all check a box. But
Yeah.
if we'd have to figure out a way to.
Where do those numbers go?
Do that.
Who gets them? Do we get them here at the county, or do you get them at Cigna, or what?
Which numbers?
My HRA numbers.
It goes into the Cigna system.
Okay. So you guys are going to be tracking that information. So you'd have somewhere on my file, when you pull up my file, if I call in and say, hey, Joe Russell's calling, they pull up Joe's file, there's a box somewhere that's got HRA 2014 yes or no that you could just click off. That's something for your programmers to do, I'm sure, but I mean, is that something that you guys are capable of doing?
Well, more, I'm Cowan, Cigna's
Yeah.
here,
Yeah, I
so
know,
I'm speaking for Cigna first off.
exactly.
But the problem would be with
I've got programmers I have to deal with too, so I know it's not easy
Well, I think
as saying it, but
it's when you go into the doctor, and what I've had happen before, you go in the doctor, get an annual exam, and then you say, well, by the way, my ear's been bothering me a little bit,
Right.
and I've got this issue, and then when you leave the doctor, they code it as not a preventive exam.
right.
Because you asked about 50 other questions while you're in there, and they want to get more money because they code it differently.
Right.
Then when we run the report through Cigna, it's not going to be coded as a preventive exam. And so then that person thinks they're getting the money, they don't, and then we have to go back and forth, well, we don't show it, you do. I mean, so that would be some of just the little things of
But
that
they should
option.
get the HRA list in an email, your numbers in the email, and, your glucose is X and your cholesterol is X and all that. So they'll have something that they can send in to somebody quickly that can get that changed.
The biometric screening.
Right.
This is not the health risk assessment.
Okay.
This is a lab-based program. So we
Okay.
need lab results to feed to Cigna.
Well, the lab could then just feed the results there to Cigna to check that box off, and then whether the doctor bills it something different or not wouldn't make a difference, right?
Lab gets your results, they send them to the doctor electronically, they'll send them to Cigna electronically. It's just about that simple.
Yeah, I would think it'd make it that simple, so.
Not sure from
Yeah,
Cigna's
if we-
perspective what they can pull out or not.
Yeah.
I don't know. I'd have to ask.
My third question is, does this have to be decided upon and put in writing today?
No, it can wait till next month.
I don't
But
like to procrastinate either, I understand that.
But beyond
yeah.
that, we can't get the enrollment materials done on time.
Right, okay. I'm aware of, I know there's some time constraints that we're dealing with here as well, but I was just wondering, I've talked to a couple people about it already, and they've been pretty
Most of the
proactive
discussion is about the
it.
mechanics of what we're going to do.
Right, okay.
We do have a motion and a second. We have to deal with this motion in a second. We have a motion to accept the plan as it's been presented. I think there's some details that we're talking about as far as timing and the window of when you can have this and how that would apply for the following year, et cetera, that's not in the motion, but I guess we could determine what those issues are and those parameters are as we go forward. Mr. Hall.
I was going to say if we acted on it now, I think part of the problem too would be because when you first say this, and I could tell by the way you just got hit for the money already for next year, there's a real positive in this, and I can tell. I know Mary's going to sell it to her guys over there as something really positive, take care of them. But if you don't start it now and talking about it, getting it out there, if you throw it on all at once next month or the next, if we're going to do it, it's going to be seen even more negatively than what we could if we started it today. And I know that there's because the thing I can hear it now, if we did this at my job, it would be I'm paying more now. They want a little more, and they also want my blood. So it would be this,
Right.
and they'll be thinking they're all turnips. So you've got to sell it as that. The main reason, because actually you're going to find stuff in some of these blood works that's going to cost the county more up front right now. Our costs will go up immediately from these right here, just like they did from the health risk assessments when that happened, when we caught people but the long-term costs went down. And so we're going to take a little hit right here probably for doing it, but it's because you want the folks to be healthy and you want them to live longer and live happier lives. And so if you don't get started now, it's just going to seem like a harder push whenever it comes to it.
I mean, the ideal world, I mean, back to your point, the idea would be, here are the new rates. Not how we got to these rates, but here are the new rates, 1-1, and if you do this, we will lower them $25. So it was what's passed plus the other 25, and then you get the $25 credit. I mean, that's the best way to send the message, because it's all about messaging. That would be the best way to do that. The dilemma we had is that we wanted to be sure to give them plenty of opportunities to do it, so we thought October, carrying it into January would help. Well, then now you can't set the contributions up that way. But if we now say, well, if you had your annual exam at any time in 2013 that credits it, then maybe we can, that very first deduction in January, switch that and give them the credit right off. And I think that sounds better to me as an employee as, well, as a $45 increase for single coverage, but if I do this, it's only going to be $20.
Let's think through this a little bit. The chair is not supposed to do this. We have a motion and a second on the floor, and we're talking about a lot of things that need to be determined and decided process, procedure-wise. I think it would be wise if someone today would be willing to suggest that we defer this until next meeting time. And then let our risk management director and Mr. Brown come back with a more specific, detailed plan of the mechanics of how this might work. Mr. Jordan?
You realize the commission doesn't meet in July. So if we pass this now, it could be acted upon in June. If not, it's going to be August before the commission meets. Just a thought there. And the commission is not real big on taking the recommendations of the insurance committee verbatim, so this will get beat up all over again and twisted and changed and turned and inside out. But I mean, but it may get tweaked a lot at that point. But just for a point, no meeting in July. If we defer this a month, it'll be August before it gets, at the earliest, for it to be voted on.
I think the other difficulty is this, though. If we really want to be sure there's a reasonable probability of getting fair attention, I'm not sure we're going to get this at the June meeting with the budget before us and what we've already discussed extensively about the increases we've just put in place for January the 1st. Mr. McAdoo called for the question. All in favor of the, do we have a second on calling for the question? Do I have to have a second on calling for the question? I don't even know. Just to be sure, can I get a second on his motion to call for the question from some second? Ms. Boney. All right. All of you in favor of calling for the question, raise your hand so I can count, because y'all have to have a. All right. 1, 2, 3, 4, 5. Hold your hands up. 1, 2, 3, 4, 5, 6 people have said let's vote. That is not a. I have to have a 2/3 majority for the question. So we didn't call for the question. Didn't pass. So Mr. Jordan.
I don't know if this is in order or not because you have a motion on the floor, but I believe a motion to defer would trump a motion on the floor, because you are right. We're going to be dealing with the budget at the June meeting and stuff, and it may be best. I don't know if Ms. is going to put Ms. Stinson and her staff in a bind if we approve this in August, but if you guys can make that work, I'll make a motion we defer this till next month.
And who was that? Mr. Gammon. All right. Any discussion on that? I'm not sure we can have discussion on that. All of you in favor of that, say aye. Aye. How many are opposed? Okay, so that motion to defer, we deferred this until the next insurance committee meeting. Is that was the motion? And it may be August before it actually gets to the commission, depending on what happens. All right, I think we've had a very healthy discussion. I think we all agree that we must do something, and there must be incentives for people to improve their habits and their behaviors. So we'll look forward to risk management and Mr. Brown bringing forward a little bit more of a detailed plan on implementing this, assuming we go forward with it. Is that right?
Yes, sir.
Okay, thank you, Mr. Brown. Is there any other business to come before this body? If there's not any other business, we are adjourned. Thank you very much.